Hey, future healthcare leaders. Ready to ace that internship interview?
We're here to help.
Today's deep dive is all about prepping you to land that healthcare administration internship.
The one that's going to launch your amazing career.
We're going to be focusing on one awesome resource, a blog post called Internships for Healthcare Administration.
It's jam-packed with potential interview questions and answers.
So basically, this deep dive is your cheat sheet to decode those answers and walk into that interview feeling super confident.
Because trust me, in a competitive field like healthcare administration, first impressions are everything.
No kidding. Okay, so the blog starts off with those classic get-to-know-you questions.
Right. Like, why are you interested in healthcare administration?
Yeah, exactly. And they suggested this answer. I am passionate about improving healthcare operations and ensuring efficiency in patient care. This internship provides an opportunity to apply my academic knowledge in a real-world setting, develop hands-on experience, and understand healthcare policies and management processes.
It's a pretty solid answer.
It does hit all the right notes.
Passion, real-world application, willingness to learn.
Yeah.
But here's the thing. What if everyone walks in there giving the same textbook answer?
Good point. So how do we stand out?
By adding that personal touch.
Okay, I like that. Make it more human.
Exactly. Think about what really sparked your interest in healthcare administration.
Yeah.
Was it like a summer volunteering at a hospital?
Right.
Or maybe you helped a loved one navigate the healthcare system.
Oh, that's a great point. Those personal stories really bring your answer to life.
And make you memorable. Okay, ready for a more technical question?
Oh, bring it on.
All right. What healthcare regulations are you familiar with? The blog suggests. I've studied HIPAA, Medicare, Medicaid regulations, and the Affordable Care Act. I understand the importance of compliance to protect patient information, ensure proper billing practices, and maintain ethical standards in healthcare.
Okay, so it hits all the major points.
Right. It's a good start, but it's just step one.
So what's next?
Go deeper. Let's take IPA, for instance. Don't just say it's important.
Yeah.
Talk about a recent news story like a data breach or a change in privacy regulations.
Ooh, that's smart. Connected to the real world.
Exactly. That shows you're not just, regurgitating information. You're actually thinking about these things.
I like it. So show them you're in the loop. All right, now for the dreaded situational questions.
Oh, yeah. These are the ones that really test your problem-solving skills.
For sure. Okay, so here's one. How would you handle a conflict between two employees? The blog suggests. I would first listen to both sides to understand the issue. Then, I would mediate a discussion to find a fair resolution, ensuring that communication remains professional and the workplace remains productive.
It's a textbook response.
It is. It is.
But does it really capture the complexity of conflict resolution?
I don't know. Not really.
Right. So how do we upgrade this answer?
Tell me. Spill the secrets.
The STAR method.
The STAR method. Okay.
It's your secret weapon for behavioral questions.
Okay. It stands for situation, task, action, and result.
All right, break it down for me.
So imagine you're back in college, working on a group project.
Okay.
Right. That's your situation.
Got it.
Your task is to improve hospital efficiency, but two team members are like constantly clashing.
Right, been there.
Right.
Yeah.
So your action, you facilitated a meeting, you let everyone air their grievances, you set some ground rules, and the result, you found a compromise that worked for everyone.
Okay, so it's all about telling a story.
Exactly. A story with a clear beginning, middle, and end.
Right.
And the more you practice telling these stories, the more natural it'll feel.
Got it. Practice makes perfect.
Now, are you ready to tackle those future-oriented questions?
Oh, the ones that make me question my entire career path? Yeah, those ones. Like, where do you see yourself in 5 years? The blog recommends saying, I see myself in a healthcare administration role, contributing to process improvement and patient care efficiency. I aim to continue learning and growing in the industry, possibly pursuing leadership opportunities.
Okay, so it shows ambition.
It does, but it's a bit generic, right?
Very true. Like anyone could say that.
Exactly. So remember, this is your chance to showcase your unique aspirations.
Okay, so what makes me me?
Exactly. Is there a specific area of healthcare administration that you're passionate about?
Ooh, that's a good point. Like maybe I'm super interested in optimizing operating room efficiency.
Right. Or improving patient flow in emergency departments.
Yeah. So I need to tailor my answer to what makes me unique.
Exactly. All right, you ready for some more challenging questions?
Oh, bring them on. I'm feeling pumped.
Let's dive in.
Okay, so let's jump back into this blog post and see what other interview gold we can unearth. Ooh, here's one that's interesting. How does healthcare administration contribute to patient care? The blog recommends saying, healthcare administration ensures that operations run smoothly, staff have the necessary resources, and policies comply with healthcare regulations. Efficient administration supports patient safety, reduces wait times, and enhances overall healthcare quality.
You know, it really highlights that crucial link between what we do and the patient experience.
Yeah, it's easy to forget sometimes.
Right, because people might think healthcare administration is all about paperwork and spreadsheets.
Oh, totally, but it's so much more than that.
Exactly. Think of it like this. When those administrative processes are running smoothly, it frees up the doctors and nurses to focus on patient care.
Makes sense. It's all connected.
Right, it's the backbone of the whole operation. Okay, ready for a question that might make you sweat a little?
Ooh, lay it on me. I'm ready for a challenge.
All right, here we go. What do you know about healthcare billing and insurance processes? The blog suggests this answer. I understand that healthcare billing involves coding, claims processing, and insurance reimbursements. Proper documentation and adherence to policies are essential for accuracy and preventing fraud.
Okay, so it's a decent overview, but healthcare billing is super complicated, right?
It is a whole world of its own, so how do we make this answer stand out?
Yeah, how do we go from just reciting facts to actually sounding like we know what we're talking about?
By being specific. So instead of just mentioning, like, coding, you could drop some knowledge about specific code sets.
Oh, I see, like ICD-10 or CPT.
Exactly. Or talk about electronic health records and how they streamline billing. Show them you've actually done some research.
Okay, so specifics and real-world examples. Got it. All right, here's a question that tests our ethical compass. What would you do if you noticed a discrepancy in a patient's medical billing? The blog recommends this answer. I would report the discrepancy to my supervisor and double-check the records for accuracy. Addressing billing errors promptly is essential to maintaining transparency and trust in healthcare services.
Now that's an answer that shows integrity.
It really does. It's all about doing the right thing.
And it also subtly shows that you understand the importance of following procedures.
Oh, yeah, not just trying to fix it yourself.
Working within the system. Okay, ready to dive into some behavioral questions?
Yes, let's do it.
All right. These are the ones where you get to tell those mini stories.
Ooh, I like stories.
Me too.
Okay.
So here's a classic one. Describe a time you worked in a team to complete a project. The blog suggests. In my coursework, I worked with a team to create a healthcare cost reduction proposal. We delegated tasks, conducted research, and collaborated to develop solutions, ultimately presenting our findings successfully.
It's a great example, but remember our STAR method from.
Oh, yes. Now's the time to really make this answer shine.
Okay, so how do we apply it here?
Well, first, set the scene. Describe the project and your team.
Okay.
Then, outline the task. What were you trying to achieve?
Right.
Next, talk about the action. What steps did you take?
Got it.
And finally, highlight the result. What happened? What did you learn?
Oh, I see. So it's all about telling a story with a clear structure.
Exactly. It makes it more engaging and memorable. Okay, let me try another one. Tell me about a time you had to multitask under pressure. The blog's answer is, during my part-time job, I managed administrative tasks while assisting customers. Prioritizing urgent tasks and staying organized helped me maintain efficiency and meet deadlines.
Okay, another great opportunity to use the STAR method.
Right. Show, don't tell.
Storytelling is key. Okay, I'm ready for more. Let's talk about skills.
Oh, yeah, those are important.
For sure. So here's a question. What administrative skills do you bring to this internship? And the blog says, I have strong organizational skills, attention to detail, and proficiency in Microsoft Office and healthcare management software. I am also adept at data entry, scheduling, and document management.
Solid list of skills, but how do we make it even better?
By adding some personality.
Yes. And by giving examples.
Oh, I see. So instead of just saying, I'm organized, tell a story about a time when my organizational skills saved the day.
Exactly. Or how your attention to detail prevented a scheduling disaster.
I like it. Let's try another one. How would you improve efficiency in a healthcare office? The blog's answer is, I would analyze workflows to identify bottlenecks, streamline scheduling processes, and implement digital tools to reduce paperwork and enhance communication among staff.
That shows you're thinking about practical solutions.
Yeah, and it aligns with how healthcare is changing, right?
Absolutely. Efficiency is super important these days.
All right, I'm feeling pretty confident about those skills-based questions now.
Great. But we're not done yet. We still have those final, crucial closing questions to discuss.
Okay, let's do it. Let's finish strong. Okay, so now we're in the final stretch, those closing questions that can really seal the deal.
Right. And these often focus on your character, how you handle those tricky situations.
Yeah, like ethical dilemmas, which, let's be honest, come up all the time in healthcare.
Absolutely. So let's start with a tough one. What would you do if you witnessed unethical behavior in the workplace? The blog suggests saying, I would follow the organization's reporting procedures and inform my supervisor. Upholding ethical standards is crucial in maintaining trust and compliance in healthcare.
That's a good answer. Very by the book.
Right. It shows you're not going to just ignore it.
Yeah, you take ethics seriously.
Okay.
Okay, let's talk about compliance specifically.
Fair
This
enough.
question says, how do you ensure compliance with healthcare policies? And the blog suggests, I stay informed about policies through training, research, and adherence to protocols. Ensuring that all actions align with legal and ethical guidelines is key to maintaining compliance.
That really emphasizes the importance of staying up to date.
Oh, for sure. Healthcare policies are always changing, it seems.
Right. So you got to be proactive. Okay. Ready for some grand finale questions?
Hit me with them.
All right. What do you hope to gain from this internship? The blog says, I hope to gain hands-on experience in healthcare operations, enhance my problem-solving skills, and learn how to navigate challenges in a real-world setting. This internship will provide invaluable insights into my future career in healthcare administration.
Good answer, but a little generic, don't you think?
Yeah, it could be more specific.
Right. Instead of just saying hands-on experience, I could talk about a specific area I'm interested in.
Exactly, like revenue cycle management or electronic health records.
Yeah, something that shows you've done your research.
Okay, last question. Deep breath. Where do you see yourself in 5 years? They suggest. I see myself in a healthcare administration role, contributing to process improvement and patient care efficiency. I aim to continue learning and growing in the industry, possibly pursuing leadership opportunities.
Okay, it hits the main points, but
It could be more personal.
right, right. So instead of just leadership opportunities, maybe I talk about leading a specific kind of initiative.
Exactly, like quality improvement or patient satisfaction. Show them you have a vision.
Wow, we covered a lot today. I feel way more prepared for my interview now.
Me too. Remember, be confident, be yourself, and tell those stories.
And don't forget the STAR method.
Oh, that's your secret weapon. All right, future healthcare leaders, that's a wrap on this deep dive. But we want to leave you with one final thought. What do you think are the biggest challenges facing healthcare administrators today? And how can you be part of the solution? We want to hear your thoughts, so keep that conversation going. Thanks for joining us.